Good afternoon, Edfield Levius. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Good morning, Mihiraa. My name is Edfield Levius, and I'm the nurse who will be looking after you today. Please have a seat. Could you please confirm the reason for your visit?
Hello. I'm here for the blood test.
Thank you for the confirmation, Mihiraa. And how are you feeling?
Well, to be honest, I'm feeling very anxious about it.
I can hear that this is causing you some worry, and that's completely understandable. Thank you for telling me. Mihiraa, my main task right now is to help you feel more comfortable. To help me do that, could you tell me a bit more about what's making you feel so nervous today?
Well, I've just always had a real fear of needles. The thought of it going into my skin makes me feel very uneasy. I'm scared it will be quite painful, and sometimes I even feel a bit faint. I just need some reassurance about what will happen.
Thank you for sharing that with me, Mihiraa. It really helps me understand how to support you, and I want you to know that many people feel exactly the same before a blood test. It's completely understandable to feel nervous, and we will take things at your pace to make sure you remain as comfortable as possible throughout the process. Let me reassure you that this is a very common procedure, and we perform it safely and gently every day. Before we go ahead, I'd like to explain why this blood test has been recommended. It forms an important part of your general health check. It helps us gain a clearer picture of how your body is functioning. The sample allows us to look at several key indicators, such as how well your organs are working and whether your cholesterol or blood sugar levels are within a healthy range. It also helps us identify issues like low iron, which can affect your energy and overall well-being. Having this information is essential because it enables us to detect any early changes and support your long-term health more effectively. Mihiraa, I also want to reassure you about the procedure itself. Although the thought of it can feel overwhelming, the actual process is very quick. From cleaning the area to taking a small sample, it is usually completed within just a couple of minutes. I will talk you through each step as we go, and if at any point you need a moment or feel unsure, please let me know. My priority is to keep you informed, calm, and comfortable throughout.
Okay, that makes sense. But what exactly will happen? And are you sure it will be quick? I'm also worried that something might be wrong, and that's why I need the test.
Those are really important questions, Mihiraa, and I'm glad you asked them. Let me walk you through the process step by step so you feel fully prepared and know exactly what will happen. Before we start, I'll gently clean a small area on your arm with an antiseptic wipe to make sure the skin is completely clean. After that, I'll place a soft elastic band, known as a tourniquet, around the upper part of your arm. This simply helps the vein become more visible and easier to access, and you may notice a brief feeling of tightness. When everything is ready, I will insert a small needle into the vein. Most people describe the sensation as a quick, sharp scratch that lasts only a moment. Once the needle is in place, I'll collect a small amount of blood into a tube, and this part usually takes less than a minute. As soon as we have the sample we need, I will remove the needle, apply gentle pressure with cotton to stop any slight bleeding, and then place a small plaster over the area to protect it. Throughout the procedure, I'll let you know what I'm doing so there are no surprises. Mihiraa, do you have any concerns or questions?
Is there any easy way to do the procedure?
That's a very good question, Mihiraa. And yes, there are several ways to make the procedure feel much easier and more comfortable. One of the most effective things you can do is focus on slow, steady breathing. Taking a deep breath in and then letting it out slowly can help your body relax and reduce that tense feeling. Many people also find it helpful to look away during the needle insertion, as avoiding the visual cue often lessens anxiety. If you prefer, we could talk about something unrelated while I'm preparing everything. Simple conversation can work as a great distraction and helps keep your mind occupied. Mihiraa, if you're someone who tends to feel faint or lightheaded, we can absolutely adjust things to keep you safe. I can have you lie down throughout the procedure so you feel more stable, and we'll take it slowly to make sure you remain comfortable. If you're especially sensitive to pain or the idea of the needle, we can also consider using a numbing cream, which dulls the sensation in the area. My aim is to make this as easy as possible for you, so please let me know what you think would help you the most.
I think I would prefer to lie down. That would make me feel better. And I will definitely look away.
Before we move ahead, Mihiraa, I'd just like to make sure you've been able to follow the instructions for this test. Were you advised to fast beforehand? And if so, had you avoided eating for the required time? It's also helpful to stay well hydrated before a blood test, as drinking enough water can make the process smoother and more comfortable. Let me know if you were able to drink some fluids earlier today.
I did fast since last night, as the instructions said, and I drank some water this morning.
That's perfect. Thank you for confirming that you followed the pre-test instructions. That's very helpful for accurate results. So, to confirm, you are happy for us to proceed with a blood test? We will do it with you lying down, and you will look away. We will go at your pace.
Yes, I think I'm ready to go ahead now. Thank you for explaining everything.
Thank you, Mihiraa. Before we start, let me briefly summarize what we discussed so you feel comfortable and prepared. You came in today for a routine blood test and share that you were feeling anxious because of your fear of needles and past experiences of feeling faint. I reassured you that this is completely normal and that we will take the procedure slowly, ensuring you feel safe throughout. We talked about why the blood test is important, including checking your general health, cholesterol, blood sugar, and iron levels. I then explained the steps of the procedure so you know exactly what will happen. You asked how to make the experience easier, and we discussed useful strategies like slow breathing, distraction, looking away, and lying down. You said lying down would help most. You also confirmed that you followed the fasting and hydration instructions. Now that everything is clear, you've given consent to proceed.